here's something I haven't said for a while. Some cities are talking about rolling back COVID restrictions as the Delta surge starts to ease. Is the U.S. moving into a new stage of the pandemic, and can people start to relax a little bit? Well, joining me now to talk about that is Chief Medical Advisor to President Biden, Dr. Anthony Fauci. So, Dr. Fauci, more than 3 in 4 eligible Americans have now gotten a vaccine shot. For the first time in more than 2 months, the U.S. is reporting fewer than 100,000 daily cases. So are we at a new hopeful moment in the pandemic?
Well, Dana, it's certainly going in the right direction. As you mentioned, the 7-day average of cases is below 100,000. It's about 95,000. Hospitalizations are down below 10,000, around 7,400. And deaths are down below 2,000. They're now around 1,400. So it's certainly going in the right direction. That's the good news. And hopefully it's going to continue to go in that trajectory downward. But we have to just be careful that we don't prematurely declare victory in many respects. We still have around 68 million people who are eligible to be vaccinated that have not yet gotten vaccinated. And even those who have been vaccinated, I mean, you want to look forward to holiday seasons and spending time with your family and doing those sorts of things. But don't just throw your hands up and say it's all over, because on the one hand, we do want to celebrate and look forward to the fact that we are going in the right direction. But if you look at the history of the surges and the diminutions in cases over a period of time, they can bounce back. So we don't want to always, be on our edge that it's going to happen, because it won't if we do what we should be doing, namely particularly getting more people vaccinated. Another important point, Dana, is that right now the data regarding the safety and the immunogenicity of vaccines in children is going to be coming before the FDA relatively soon. And if they then wind up getting vaccinated, then yet you have another segment of the population that can be protected.
So you mentioned the holidays, Thanksgiving and Christmas. It's hard to believe it. They are just around the corner. Canada just imposed a vaccine mandate for eligible travelers on airplanes. Former President Obama's Secretary of Transportation, Ray LaHood, says that the White House should push airlines to mandate vaccines or mandate them itself. So would you like a vaccine mandate for air travel in effect for the holidays?
Well, it depends on what you mean. If you're talking, we do now have a situation when people coming in from outside of the country who are not United States citizens, they really must require that they get vaccinated as well as getting tested before. What the president has done regarding masks, I think, is important, namely doubling the fine on people who refuse to wear masks on airplanes. On the table is the issue of mandates for vaccine. It's always discussable. We always wind up discussing it.
Do you support it?
But right now, I don't see that immediately. Dana, I don't want to say support or not. I think it's a decision that's made by input from a number of parts of the government, including public health. I mean, obviously, from a public health standpoint, the more protection you get, the better it is. But I don't want to be weighing in, because we wind up then having people taking things out of context. We have everything on the table, and it will be discussed by the medical group.
Dr. Fauci, it has been 263 days since President Biden took office, and the Food and Drug Administration still doesn't have a permanent commissioner, still in the middle of a pandemic. The acting chief can only stay in her post until next month. Don't you think it's important for the FDA to have a permanent Senate-confirmed commissioner?
Oh, of course it is, Dan. I mean, we all know that. I mean, there are some candidates that are still being discussed, and hopefully we will have an FDA commissioner in a very reasonable period of time, hopefully quite soon. But yes, I agree with you. Obviously, when you have an agency as important as the Food and Drug Administration, you want to have a permanent head in there as soon as possible. That goes without saying.
One last question. Halloween is just around the corner. A lot of parents are wondering how to trick or treat. Do they hand out candy? Do they walk around with their children? What's your guidance?
I think that particularly if you're vaccinated, but you can get out there, you're outdoors for the most part, at least when my children were out there doing trick-or-treating, and enjoy it. I mean, this is a time that children love. It's a very important part of the year for children. I know my children enjoyed it. So, I mean, again, particularly if you're vaccinated. If you're not vaccinated, again, think about it, that you'll add an extra degree of protection to yourself and your children and your family and your community. So it's a good time to reflect on why it's important to get vaccinated, but go out there and enjoy Halloween as well as the other holidays that will be coming up.
I was just told I actually have a few extra seconds, so I'll put this question to you. How long do you think it will be until it's safe for vaccinated people to once again be indoors without a mask?
You know, it's always tough to predict that. I think if we continue to go down in the cases that we're seeing right now and more people get vaccinated, as the dynamics of the outbreak, namely the amount of virus circulating in the community, goes down, I hope we'll be able to pull back on some of those restrictions to get closer to what we really feel is normal in the community. I hope that's soon, but I can't give a prediction of a date on that, Dana.
What do you need to see?
Well, I need to see the dynamics of the outbreak in the community go way down. Right now, even though we just said it's going in the right direction, we have less than 100,000 cases a day. It's about 95,000 as the 7-day average. That's still way too high. We want to get way down to that. I mean, I'd like to see it well below 10,000 and even much lower than that. But when you're at 95,000, that's still a situation where you have a high degree of dynamic circulation of virus in the community.
Dr. Schaffner, I guess Dr. Fauci is right about being very cautious. And I mean, we all want this to end. We all want to see that light at the end of the tunnel, but we've seen this movie before, and the Delta variant was not the light at the end of the tunnel. It was an oncoming train.
Yeah, that's exactly right, Jim. I share Dr. Fauci's cautious optimism, but I emphasize cautious because we're not there yet. Yes, vaccinations are increasing, and cases and hospitalizations and even deaths over most of the country are now decreasing. I certainly hope that that continues. But you know, we still have two Americas out there. Those states that are highly vaccinated and the states such as my own in the Southeast and in the Midwest, where vaccinations in parts of the state are still very low. And so this illness, this virus can continue in those places where vaccination rates are low. And so we'll probably see two trajectories out there, one steeper than the other.
And this week, FDA vaccine advisors will meet to discuss Moderna and Johnson & Johnson's application for booster shots. Right now, Pfizer's is the only one that's been approved under emergency use authorization. When do you think we're going to see those additional boosters? Everybody wants to know.
Well, my fingers are crossed, Jim. I hope the Food and Drug Administration gives the thumbs up to both of those boosters, the Moderna and the J&J, this week. The CDC's advisory committee will meet very shortly thereafter, and I think the green light will be on. So I'm optimistic about that. So everybody who's gotten whatever vaccine will be eligible for a booster pretty soon, I think.
And what about that mixing and matching? People want to mix and match. I mean, I just want to get the same one again. I guess some people like to mix and match. They like variety, I guess, is what it is. But what are your thoughts on that?
Yeah, well, they're doing more mixing and matching in Europe. And there are people who are interested in that for a variety of reasons. The FDA's committee will look about that also. And I anticipate within limits, they will say that that's okay too. But that's all anticipatory. Let's see what they say by the end of the week.
And some of America's youngest kids, ages 5 to 11, might soon be eligible for a vaccine. Pfizer announced this week it asked the FDA to authorize its vaccine for kids that young. How big of a game changer is this in your mind? And what do parents need to know? I mean, obviously, this issue of how large of a dose the kids are receiving, that is critically important because people might have a bit of a misnomer about that.
Sure. Well, the Pfizer vaccine, which is once again first in line for children 5 through 11, has reduced its dose in those children. And the data that I've seen so far, I haven't seen them all, but the data I've seen so far indicate that you get just as good an immune response, and the side effects are comparable to what teenagers and young adults get. So that'll be very, very important. The FDA's committee and the CDC's committee will have a discussion about that because they'll be balancing the need for these vaccines, which many of us want, versus safety issues. Parents will be very interested in that.